the first thing I would say is that sometimes there's a simplistic nomenclature in the field whereby you may read or hear about neurodegenerative disorders of language. And sometimes that is taken in a very restrictive manner to refer only to primary progressive aphasia and its variants, or maybe even primary progressive apraxia of speech, as if there were neurodegenerative disorders which compromise language functions and others which don't. And I believe that this is a wrong or a suboptimal way of framing the issue. The fact is that because the brain networks that are implicated in speech and language processing are so widely distributed across our brains, across both hemispheres, across all four lobes, in cortical and subcortical regions, it's very improbable that any form of neurodegeneration will not impact on at least some linguistic dimensions. And that's precisely the case when you take a look at neurodegenerative diseases that are not primarily typified by linguistic disturbances such as Parkinson's disease or Huntington's disease or a typical Alzheimer's disease. Linguistic deficits are actually quite pervasive. They can be seen in early or preclinical prodromal disease stages. They are good predictors of non-linguistic symptom severity, such as, for example, motor disturbances in Parkinson's disease or overall cognitive status in Alzheimer's disease. They can predict disease-specific patterns of atrophy or abnormal functional connectivity. So I think that what the main idea I would like to convey here is that it would be in our best interest if we want to have a more comprehensive understanding of the impact of neurodegeneration in the human brain and also of language as one of the faculties that the human brain endows us with, not to restrict our research on language dysfunctions to those diseases that are primarily typified by linguistic deficits, but to have a more comprehensive and inclusive approach whereby we understand that pretty much any form of neurodegeneration may have greater or lesser and more general or more focal impact on at least some linguistic dimensions. The field, I believe, is slowly veering in this direction, and I think that's good news. Language is constitutive of who we are, and any type of speech or language impairment can be detrimental to our daily function, to our self-image, to our ability to perform in social, professional, educational settings. So the more we learn about this across different disorders, the better we will be doing our job, I believe.